Aside from understanding the disease process, and the concurrent anatomical and physiological changes that come with the disease, when you try to analyze the data that you have gathered, uh, and analyze the diagnosis, the nursing diagnosis that you have identified. It is imperative also that the nurse understands disease causation to be able to intervene effectively. Because as I have said, or as we have said in the previous session, rooting out the causes of suffering is hitting the nail on its head. Because we cannot resolve the problems effectively if we don't address the factors or the reason causing that disease, that illness, or that suffering. When we talk about disease causation, there are actually various theories in disease causation, which I have mentioned also from the previous session. So when you read literatures on etiology and epidemiology, you will discover that there are various theories. And maybe you also have heard some of these theories already in the past. But just to mention a few, let me share the germ theory. So the germ theory is one of the earliest theories of disease causation proposed by Pasteur, which describes microorganisms such as viruses, bacteria, and protozoa as the causative agents of infectious disease. So that is according to the germ theory. Another theory that you may encounter or you might have encountered is the biomedical theory, which asserts that or proposes that disease is caused by malfunctioning of cells, tissues, and organs with resultant signs and symptoms. Okay? We also have psychosocial theory that integrates physiologic, psychological, and sociological factors that influence disease development. We also have biopsychosocial spiritual theory, which proposes that the body, mind, and environment all interact together in the development of disease. And we also have the multi-causal theory, the model that explains or attempts to explain that the effects of different factors such as nutrition, lifestyle, genetics, and stress in a person's health and affects also the development of the disease. Now, in doing the nursing process and applying each step in your learning experience, in the related learning experience or your RLE, one of the models that we utilize to understand disease causation of our clients is the Ecologic model because of its applicability in helping student nurses to understand and comprehend and eventually analyze the patient's health problems. Particularly the disease causation experienced by the patient. It is assumed that upon careful analysis of causation, a nurse will be able to effectively plan for possible nursing interventions appropriate for their client's case. All right? So the ecologic model is also called the agent-host environment model, which originated in the community health work of Livell and Clark in 1965. Take note that it is used primarily in predicting illnesses rather than promoting wellness. Okay, so again, the agent, the host, the environment model, or the ecologic model. Now, to further explain, according to Livell and Clark in their book on preventive medicine for the community published in 1958, they said that disease, defect, disability, or death results from interactions between these three factors, the agent, the host, and the environment. Hence, the ecologic model came into being. Livell and Clark quoted Gordon, who is an epidemiologist, with the definition of ecology as the biologic discipline, which has to do with the mutual relationship of various living organisms in an environment and their reaction to animate and inanimate surroundings. Or simply, it is the influence of the total environment on the behavior of living things. In agreement to that, ecology is defined by Mosner and Ban in 1974 as the study of relationship of organisms to each other as well as to all other aspects of the environment. Dr. Remigio Mercado also in his book on epidemiology also defined ecology as the study of the relationships of factors in the constitution of a whole or in the creation or precipitation of an action or event. So since disease arises within an ecological system, an ecologic approach is necessary to explain the occurrence of disease. Mosner and Ban further asserted that disease cannot be attributed to the operation of any one factor only, thus discrediting the earlier theories on disease causation, which I have mentioned a while ago. This requirement for more than one factor to be present for disease to develop is referred to as the multiple causation or the multifactorial etiology. By the way, etiology is the study of causation. The epidemiological concept of disease causation strongly asserts that there can be no single cause of disease, as according to Dr. Remigio Mercado. To explain further, Mosner and Ban wrote that at first glance, it might seem that the introduction of an organism into a community would be enough to explain the development of a disease occurrence, like in the case of an epidemic or a pandemic nowadays. However, the organism alone is not sufficient to account for the outbreak and cannot therefore be considered the cause. The organism alone, the agent alone, is not a sufficient cause because suitable conditions of the host and the environment must also be present for disease to develop. The level of immunity, the resistance of the host, of the population is also crucial, like in the case of COVID-19 nowadays. Another example that Dr. Remigio Mercado has given in his book is a person, a client who may have harbored pneumococci in his throat for a long period of time and yet may not get sick of the disease. Then on a certain day, he may get wet by the rain on his way home from work, and he is also very tired. Now that could easily result in pneumonia in the following days. One could say that, or one cannot say that the rain alone caused pneumonia because there are many people who get wet by the rain anyway, and yet they do not get sick. Also, even if the patient's resistance decline, the host resistance decline because of stress from work, he will not get sick if there are no infectious organisms like the pneumococci harbored by the client, by the patient. Another example is, at present, some people are asymptomatic but are carrier already of novel coronavirus. So harboring the virus alone will not cause COVID-19 signs and symptoms to appear. In addition, environmental conditions also determine whether effective transmission of disease can occur in any given situation. For example, the degree of contact, the reason why social distancing is now recommended as a precaution for controlling the spread of novel coronavirus causing COVID-19. Also, the level of hygienic practices. That's why people nowadays are asked to do hand washing more frequently than ever. So in essence, the host factors affect the susceptibility to disease, while environmental factors influence exposure and sometimes indirectly affect the susceptibility of the host. The interaction of these factors determine whether or not disease will develop. Okay, is that clear? Now let's closely examine the components of the ecologic model. The agent, which is according to Level and Clark, an agent is um, any element, substance, or force, whether living or non-living, the presence of which can initiate or perpetrate a disease process. It is also, in some literatures, it is also referred to as any environmental factor or stressor. So previously, the agent was considered to be part of the environmental factor, right? And the agent may be classified as biologic, chemical, mechanical, physical, or psychosocial, that by its presence or absence can lead to illness or disease. Okay? Now, there are the different agents according to its classification. So we have mentioned nutritive agent, and these are the examples of the nutritive agents that can cause a disease: chemical agents and physical agents. All right. I hope that you can see that in the slides, the examples. Examples also of infectious agents are written in the slide, and also the mechanical agents, psychosocial agents like stress. Okay. Next is the ecologic model, host factors. So we have examined the agent. Now let's examine the host factor. So the host is the person who may or may not be at risk of acquiring a disease. It may include his family history, age, and lifestyle habits, which influence his reaction, the host's reaction. So the host means an individual exposed to the agent, or the host is our patient. A contact and a suspect may eventually become a host of the disease. A carrier can, in a way, be classified as a host according to Dr. Remigio Mercado. In parasitology, distinction is made between a definitive host and an intermediate host, which we will learn later in the subject communicable disease. Now, in certain illnesses, man is the definitive host, like in the case of malaria, where the sexual stage of the parasite develops. So, yeah, you will learn that also in the communicable disease subject. And in other illness, man is an intermediate host. But the primary focus in the ecologic model is what happens to the host, whether it gets sick or not, whether man becomes a carrier, a source, or a reservoir. The study of the characteristics of host is important in understanding the disease process. Such characteristics, again, would include the age, the race, the sex, the habits, the customs and religions, exposure to the agent also, and defense mechanisms of the host, which includes natural and acquired defense mechanisms like specific anatomical defenses, immunity, resistance, tolerance, state of nutrition, and others. Okay, is that clear? Next is the environmental factor of the ecologic model. So the environmental factor are all factors external to the host that may or may not predispose the person to the development of the disease. Physical environment includes climate, living conditions, sound, noise levels, and economic levels. Social environment would include interactions with others and life events such as death of spouse. Also, in essence, the environmental factor is the sum total of an organism's external surrounding conditions and influences that affects its life and development. In ecologic model, the focus is directed to the effect of the environment on the agent and on the host. Is that clear? The environment may be grouped again into three categories, which includes, I have mentioned already, the physical environment, the biologic environment, is also another category, and the socioeconomic environment. Okay, now how do we apply this ecologic model in understanding uh, our clients, particularly the disease causation? Okay, again, it is essential to be able to evaluate the interactions of the components of the ecologic model, namely the host, the agent, and the environment. So, and it is also important that we will be able to choose a particular model that is most appropriate, not to explain the causation of a particular disease process. Now, this relationship or this interaction between the factors could be a relationship between the agent and the environment, or it could be an interaction between the host or the environment, or it could be an interaction between the human host or the agent, or it could be an interaction between the three, the agent, the host, and the environmental factors. Okay? According to Mosner and Ban, several alternative models have been developed to depict the ways in which these interactions occur. Whichever model is used, it is important to realize that the balance of forces that determines an individual's state of health at a given time is in a kind of dynamic equilibrium, which means a potentially harmful change in any case can affect that dynamic equilibrium. We mentioned that a model illustrates the relationship of concepts. In the case of the ecologic model, we have the lever model, the wheel model, and the web model, which all illustrate how the agent, the environment, and the host factors relate with one another to cause a disease. Now, to further understand how we apply these different models, let's take a look at the epidemiologic triangle, with, or the epidemiologic lever. Mm. The epidemiologic lever or the lever model uses the epidemiologic triad or the epidemiologic triangle. Okay, where three, okay, so the epidemiologic triangles depict the agent, the host, and the environmental factors. The epidemiologic triangle as a term was used sporadically in the early 1900s, specifically in 1920s, if you're going to go through with the literatures in the past. It was used for many years and still is referred to frequently in the epidemiological literatures. The epidemiologic triangle again consists of three components: the host, the agent, and the environment. The model implies that each component must be analyzed and understood for comprehension and prediction of patterns of disease occurrence. A change in any component will alter the existing equilibrium to increase or decrease the frequency of disease. So in the epidemiologic lever that uses the epidemiologic triangle, it highlights the it highlights the agent as a separate component of the disease, which originally was considered to be part of the environment, as we have mentioned a while ago. And this model is usually or is often used in understanding infectious diseases. Okay. However, with the recent application of the epidemiological concepts and methods to other categories of disease, there are conditions that are not solely linked to agents such as schizophrenia, coronary heart disease, and rheumatoid arthritis, which you will learn later on when you take up your medical surgical nursing. Okay. Also, the epidemiologic level, you can choose or you can illustrate in a diagram how the relationship of the agent, the host, and environment is depicted. Also emphasizing a particular client's case scenario. Like in this example, if you notice in this slide, in this model, there is an increase in the ability of an agent to infect and cause disease in man. So if you can see this other end of the spectrum where the environment is the fulcrum, you are seeing that the agent has greater weight because it has an increase in the ability, to infect the host, thus causing disease. Okay, another example, in the epidemiologic level, you may illustrate that the environment, the proportion of the susceptibility in the human host population uh, is increased, can be illustrated using this model. So you are looking at the host, on the other end of the spectrum, has having a much greater weight, than the agent. Also, there might be cases wherein the environmental change can facilitate the spread of the agent. Okay, so, and in this case, giving more weight on the agent with the environment moving away from the center of the spectrum. Okay, so it's not favoring the host, but actually moving away from the host, from the agent. No? Kaya mas mabigat ngayon ang agent because the environmental changes has moved away from the agent, thus providing it more weight, more chances for spread. Also, another diagram that you can illustrate now using the epidemiologic lever is to depict how environmental change alters the host susceptibility, thus providing more weight again, on the host characteristics to cause a disease. So you will see the environment as the fulcrum moving away from the host, providing it more weight. Okay. So this is how we illustrate the different situation of our patient. Where disease agent or the agent of the factor, the agent factor is emphasized. Okay. Pero yun nga, we have said that the recent application of epidemiologic concepts and methods to other categories of disease, it was revealed that there are conditions that are not solely linked to agents such as schizophrenia, coronary heart disease, and rheumatoid arthritis. Hence, there are models now that have been developed that de-emphasize the role of the agent and rather stress the multiplicity of the interactions between the host and the environment. Hence, the web model of causation and will emerge. Okay, for the web causation, as you can see in the slide, this is an illustration of the web model for the coronary heart disease. Okay. Now, what is the web model of causation? The notion of web as a causation model was put forth by McMahon and his colleagues in 1970, which is cited also by Mosner and Van in their book. So the essence of the concept is that effects never depend on a single isolated cause. Rather, it develops as a result of chains of causation, in which each link itself is the result of the complex genealogy of antecedents. So the large number of antecedents create a condition that may appropriately be conceptualized as a web, which in its complexity and origins lies quite beyond our understanding. So an example again of a disease of causation of which can be depicted using the Webb model is the coronary heart disease. It is evident now in the model that multiple factors promote or inhibit the development of coronary heart disease. Some of these factors are intrinsic to the host, and there are also some components that are external, okay, which are also subject to manipulation. All right, is that clear for the Webb model? Now next is the wheel model. The wheel model of disease causation uses the wheel in depicting human-environment relations. So the wheel consists of a hub that represents the host or human, which has a genetic code. So this is the host with its genetic code, making up its core. Now surrounding the host is the environment, schematically divided into three sectors: the physical, the biologic, and the socio-economic. I'm sorry, there has to be a separator between these two components. Okay? The relative sizes of the different components of the wheel depend on the specific diseases problem under consideration or under investigation. Now, for hereditary diseases, the genetic core, would be relatively large. But for conditions like measles, which is a communicable disease, the genetic core would be of lesser importance. The state of the immunity of the host and the biological sector of the environment would contribute more heavily. Now, like the web of causation, the model of the wheel implies a need to identify multiple etiologic factors of disease without emphasizing the agent of the disease. For example, the wheel model lays no greater stress, like for example, on rabies virus. So the wheel model lays no greater stress than on animal reservoir of the disease. However, in contrast to the web of causation, the wheel model does encourage separate delineation of host and the environmental factors as distinction useful in epidemiological analysis. Only if we can delineate concepts, then we can also analyze concepts systematically. Hence, we need this diagram. Now, in conclusion, the multifactorial nature of disease has been emphasized because of its importance for prevention and control. Recognition of the multifactorial causes has led to the awareness that studies of disease etiology must encompass multiple risk factors and their interactions. Although identification of risk factors for a disease is highly desirable, but full knowledge of etiological mechanisms also is not necessary for effective control measures. What do we mean by this? It means that even though a direct causal relationship has not been established in studies as a limitation of knowledge sometimes, but it should not stop us from doing preventive measures. Because a reduction on the causative factor can be recommended already, like in the case of the use of tobacco, in cigarette smoking. Because even though the precise mechanism by which tobacco causes cancer is not fully understood, a reduction on cigarette smoking would have more of an impact on the number of deaths attributable to cancer than would manipulations of any other single event. Another example is social distancing as a way to manipulate control measures for preventing spread of COVID-19. It doesn't need in-depth direct causal relationship analysis because practicing social distancing can already have an impact on prevention of spread as a way to manipulate the environmental factor. Okay? So those are the different models of the ecologic model. Now, how do we write the ecologic model report? Okay, we start writing the report by first writing our hypothesis, uh, by basically answering what caused the disease based from an educated guess. Okay, so it is an educated guess about what caused the disease of your patient. Next, we proceed to identifying the predisposing factors, which could be either factors from the host characteristics, the agent, and the environment. Okay. Next, we choose a model that is mostly appropriate for the disease of our client, and we choose a model that will sufficiently depict, the disease causation. Okay, which could be the lever, which emphasizes the agent, the wheel, which emphasizes, which also depicts the genetic predisposition, and de-emphasizes the agent, focusing on the effect of the environment on the host. And then next, or it could be the web, no? And we said that some disease never depends upon single isolated cause. Rather, it develops from a chain of infection in which each link itself is a result of complex interaction of preceding events. No? So again, this chain of causation may be the fraction of the whole complex, which is known as the web of causation. Now, the web again de-emphasizes the role of the agent in causing the disease. So we choose which is which, the lever, the web, or the wheel. All right? Next, in writing the report, we proceed to analysis. So what do we do in the analysis? We justify the model that we have chosen, and we also justify the predisposing factors supported by references. So we are just justifying the model based on our own opinions, but also backed up by scientific basis. Okay, and then the last part of the report is the conclusion and recommendations. By answering the questions, is the hypothesis correct? If it is correct, why? Also, in writing recommendations, uh, include the nursing actions you recommend so that recuperation of the patient will be facilitated, which is also not just based on your own opinion, but is also anchored on the accepted practice standards. All right. Now, I have here a sample case scenario, which we will also discuss in the during consultation, in the discussion board. Okay. So the sample case is about Tatay Pandemyo, a 65 years old male was admitted to Hospital X with chief complaints of difficulty of breathing. His history upon interview revealed that 2 weeks ago he took care of his wife, who was experiencing mild to severe respiratory symptoms also. And in their area, there are no quarantine facilities available, in their hometown. And the hospital told them they don't have enough facilities, like, for example, ventilators. So he decided to bring his wife to the hospital in Manila, which is 4 hours drive away from their hometown. And his wife was later diagnosed with COVID-19. Tatay Pandemyo also subjected himself for swab testing for COVID-19 at the time because of her wife, since they are also already in Manila. Now, Tatay Pandemyo, after that, experienced cough with accompanying fever and fatigue a few days after he brought his wife to the hospital. He also reported losing appetite and was continuously worried about his wife, who is in the hospital. Now, one day prior to admission, Tatay Pandemyo started to experience shortness of breath. His difficulty of breathing became intolerable this morning, hence he was brought to the ER. And his swab test also was released today, and the result is positive. Now, based on the data, you as the nurse identify this nursing diagnosis aside from the other nursing problems. No, so this is the priority nursing problem we have identified in that sample case scenario. So ineffective breathing pattern related to shortness of breath as evidenced by the cues. All right. Now let's write the ecologic report to further analyze the situation of our client. No? So it is assumed that maybe uh, you will write your explanation, no, your analysis on the certain anatomical and physiological changes that happen to Tatay Pandemio. And to continue that analysis, let's also analyze, no, the disease causation. So what caused the disease, no, of Tatay Pandemio? So we can hypothesize that the mild to severe respiratory illness he experienced, no, specifically the ineffective breathing pattern we have identified in the past 2 weeks prior to admission is caused by contracting novel coronavirus, causing COVID-19 signs and symptoms. And this novel coronavirus, overran the host or the patient or Tatay Pandemia, resulting to mild to severe respiratory symptom as a consequence of exposure to the virus due to lack of quarantine services available in the community where the patient is staying. So quite long, no, but very specific. Or in simple terms, we can say that the disease or the mild to severe respiratory illness experienced by the client is caused by his exposure, no, to novel coronavirus, uh, causing his signs and symptoms. Okay, so I just opted to write specifically, no, the details about the disease causation for everyone to see. But you can shorten this by emphasizing that the mild to severe respiratory illness experienced by Tatay Pandemio is caused by his contracting the novel coronavirus. Okay? As influenced also by uh, by host characteristics such as age and also environmental factors such as exposure, and lack of quarantine services. Okay? So the hypothesis, now uh, you can formulate your hypothesis based on your understanding of what caused the disease of your patient. The next is the predisposing factors. So you will just specifically identify what particular factors has predisposed the patient to developing the disease. Now, in our sample case scenario, it is evident that under the host factors, Tatay is already 65 years old. And literatures would reveal that senior citizens, no, the elderly, is more vulnerable to developing the disease. Diet also, the lack of nutritional diet, because he reported that he lost appetite. And then resistance, lowered resistance, also because of his age. For the agent, it was revealed in his history that he was exposed to the virus, and that as per swab testing, it was revealed that it turned out he is positive for contracting the virus. For the environment, his history revealed that he was exposed, so it is the biologic environment factor, which pertains to his exposure to people who contracted the disease or suspected of infection. Socioeconomic factors also can be can be determined, like urban crowding, home environment containing the agent, because according to his history, he took care of his wife. And then also he reported there was lack of sufficient health services for diagnosis and quarantine of infected patients in their hometown. Okay, so we have biologic, socio-economic um, factors under the environment. Now, number three, we choose now a model that best illustrates or depicts disease causation as per hypothesis. So the chosen model that depicts the disease causation in this case is the lever, where the role of the novel coronavirus is emphasized, overwhelming the host characteristics with the environmental conditions favoring the spread of the virus. Now, to show that, amongst the four diagrams that I have shown you a while ago, we can say that this model is most appropriate, which depicts that the proportion of the susceptibility of the host factors, is increased because of his age, also his exposure to the coronavirus, as favored by the environment. Okay. Now, the epidemiologic, anyway, in the discussion, during the consultation, we will discuss some more this ecologic report. Okay, so just for purposes of illustration, I am sharing this with you on how to write the ecologic report. Okay, next is the analysis. So we said that in the analysis, we need to justify the lever. We need to justify the model that we have chosen. In this case, the epidemiologic lever is chosen to emphasize the role of the coronavirus overwhelming the host with environmental conditions, favoring the susceptibility of the host to contracting the virus. Because according to Dr. Mercado, the epidemiologic lever emphasized the role of the agent in disease causation. So the host factors that we have mentioned, yung kanyang age, yung kanyang nutritional state, and also his resistance, we can make use of studies from the WHO control of the WHO, or the CDC. The CDC is the Center for Disease Control. Okay. Also with the agent, and the environment, when we justify those characteristics contributing to disease development, we back it up with literatures, with studies, with justification or with reference to reliable source. So in this case, I think we can make use sources from WHO and the Centers for Disease Control. And then last is the conclusions and recommendations. So again, we asked, is the hypothesis correct that we previously formulated? So yeah, so this is how we write, and then we also include the recommendations. So it is therefore concluded that the mild to severe respiratory symptoms experienced by the patient in the past few weeks was caused by the novel coronavirus causing COVID-19, as confirmed by the laboratory findings through the swab test, which overwhelmed the host with the presence of specific environmental conditions, making the client susceptible to contracting the virus. It is then recommended, as per WHO guidelines on coronavirus disease 19, that the quarantine and precautionary measures be practiced to prevent spread of the disease. And then you can go on discussing the specific measures recommended by WHO. Okay?